temperature should you treat your fever? And what is the best natural treatment for a fever? We'll be discussing how to treat your fever without medications today because you do not have a Tylenol deficiency. Good morning, health minded people. I'm Dr. Snow, and I help you treat minor health issues naturally. And I work with clients and their physicians to make sure they are on the fewest medications necessary to ensure the best outcomes possible. You wake up in the morning feeling achy and hot. Last, you have the flu. You hunt down the thermometer and give it a good wash because who knows when it was used last, and then you stick it under your tongue. After 3 minutes, you remove it and try to hold it just right so you can read it. 101.6? Is that high? Should you go to the emergency room or call an ambulance? Maybe jump into an ice bath. How are you going to treat this fever? What are you going to do? Well, the first thing you need to do is calm down. A temperature of 101.6 Fahrenheit isn't a bad thing. It just means that your body has been invaded and your immune system, like the good little army it is launching a counterattack to vanquish the invaders. All kinds of wonderful things are happening in your body when you get an infection. A cold, the flu, an infected wound. And while sometimes your body needs a little outside help, such as an antibiotic for a bacterial infection, usually it can fight off the infections on its own if we just give it the support it needs, like rest, fluids, and letting your body do its thing, such as raising your temperature. While a fever can make you feel lousy, it also makes the bacteria or virus that is attacking you feel lousy. While the invaders thrive when your body temperature is normal, a fever makes it more difficult for them to survive, and in their weakened condition, your body's other defenses such as inflammation, antibodies, and white blood cells can come in and finish the job. So decreasing a fever is probably not in your best interest. It is usually better to allow the fever to do its job so you can recover faster. Every time I review how the body works, I'm amazed at how well designed we are. If this information is helpful, please consider subscribing to my channel, and don't forget to hit that little bell so that you'll be notified every Monday when I post a new video that's designed to help you navigate the sometimes confusing healthcare system. So if you shouldn't try to stop or decrease a fever, what should you do to support the fever? The steps you can take to help your body help you with a fever include drinking plenty of fluids, especially cool but not cold water. While fever is good for you, it can cause dehydration, which is bad for you. Even if you don't feel like eating, drinking lots of fluids can prevent dehydration. Bone broth, herbal teas, and electrolyte replacement fluids are ideal, as is plain cool water. Sipping on these liquids all day long is better than gulping a large amount infrequently, so keep a cup close at hand. You can make your own electrolyte replacement liquid, which can save you money and allow you to control the ingredients that go into it. I will include a recipe in the description below that will get you started, but feel free to adjust the ingredients to your specific taste. You should sip on this off and on throughout the day to replace fluids and electrolytes. The sea salt replaces more than just sodium chloride, which is the only salt found in table salt, so it is important to use sea salt in the recipe. Herbal teas that may help you feel better without lowering your temperature should be chosen to support the fever. If you feel hot, you want to choose a tea that will help you feel cooler, such as elderflower tea or peppermint tea. If you have the chills, you want to warm up with ginger tea or cayenne tea. Each fever is different and may change throughout the day. You need to support your body with what it needs in the moment. So before that cold or flu hits you, Stock up on ginger, cayenne, elderflower, and peppermint so that you won't be unprepared if you become sick. And make sure you always have sea salt in the house for any time you need to make an electrolyte replacement drink. Would you like to learn if working with a health coach that specializes in helping you manage your medications would work for you? I've had a couple of coaching slots open up in my schedule, and if you would like to see if you can decrease the number of your medications while increasing the quality of your health, feeling better, and saving money, you can jump on a discovery call with me to see if we would be a good fit. I will leave a link in the description below. Of course, there are instances in which it is no longer appropriate for you to manage your fever by yourself. Fortunately, these circumstances are few and far between, but you should see your physician if you have a fever that lasts more than 3 days and you're getting sicker. If your fever is constantly over 103 degrees Fahrenheit without coming down for at least short periods at a time. Normal fevers go up and down throughout the day, usually going up at nighttime. If the fever is accompanied by a severe headache, or if you have a stiff neck and pain when you bend your head forward, if you have persistent vomiting or an unusual skin rash, especially if the rash is getting worse, and if you are unusually sensitive to bright light, have any mental confusion, difficulty breathing or chest pain, abdominal pain or pain when you urinate, or convulsions or seizures, it's time to get to the doctor immediately. If you have found this information helpful but want more information on treating simple illnesses naturally, I have created a series of videos that explain exactly how to do that. Click here now. Thank you for joining me today to learn how to support a fever and allow your body to heal itself naturally. Stay healthy, drink your electrolytes, and have a blessed week.